Okay, welcome everybody. We are live right now on YouTube, Twitch, and Facebook. And again, thank you so much for our weekly to be here on our weekly short health spaces. Today, I'm here with my co-host, Dr. Kumar. Hey, Dr. Kumar, how are you?
I'm doing wonderful. Thank you.
That's great. So, how was your week going?
Busy, but in a good way. It's not crazy, but it's good busy. Tons of patients coming in, a lot of need for help. Unfortunately, people need us.
Well, that's the important part, and it's very rare to find too, because what's your specialty? Um, that you talk about and what your belief is very rare because a lot of doctors are more in the box. They don't think outside the box. So it's great to be
Yeah.
able to
So
be in a space with you.
the counter to that is I have no box. I don't know where my box is.
You got no boundaries. Boxes.
I don't know. Hey, but whatever I do is still legal, ethical, and moral.
That's the most important part.
Yeah,
That's what I love about you.
yeah, that's the fun part too.
So let me pin up the topic that we're talking about today. Today is low intensity extracorporeal shockwave therapy. I think we've talked about this quite a bit in the past, but I'd like to continue the conversation. Let me go ahead and pin the PubMed article.
All right.
This study was very impressive because, some of the issues they were talking about and some of the patients, what their experience were incredible. So, and also, when it comes to men's sexual health, it's such an important topic to talk about. I talk a lot about women's sexual health also, but having a balanced life is the key, and sex is important. So, especially for men.
Hey, it's part of overall wellness. When we are talking about age management, age reversal, and whatever that we talk about in this space, the underlying one of the major underlying issues is sexual health in men, and that's the thing that number one, it does carry some stigma when people talk about their personal sexual health issues. Number two, there's a whole lot of mental health issues that kind of pushes that into the background, while that is the actual cause for their mental health issues. And the third thing is it's something that patients are hesitant to bring up with their primary care docs. So it's kind of a hidden epidemic. But we see that in so many other areas, they come in with issues like back pain or insomnia or so many other things. While the major issue deep down is something to do with the sexual function. So that's what I've been dealing with over the past 5 6 years since I got involved in the sexual medicine arena, especially in men. So as an oncologist, my one of the things that have been taken care of are prostate cancer patients. Whether treating prostate cancers with radiation only, with surgery only, and surgery with radiation. And one of the major side effects of any intervention that we do for prostate cancer is erectile dysfunction in men. And so when I was just a pure oncologist, men who were survivors of prostate cancer would come to me with sexual issues, and all we had to do was to give them Viagra and Cialis. And the same thing would go for the urologist. Hey, if that doesn't work, then you double up the dose, and if that doesn't work, then you go in for an implant, a penile implant. So those were the two options that were available. And so when I started digging into this a little bit deeper, that's when I discovered um, ESWT, extracorporeal shockwave therapy. Now, shockwave therapy is a terminology that I think is a huge mistake, because there is no freaking shock involved in this. People have the concept of, maybe it's an electric shock or some kind of a shock. It's not a shock. I think that name should be completely eliminated from this phrase, You can use something like sound waves and something benign, because shockwave gives you the impression that you're basically frying the penis, or electroshocking it to life. That's not the way this thing is. That's not how it works. So this particular field of medicine has been used in lithotripsy. So lithotripsy is a procedure that is done to break up kidney stones using sound waves. So intense sound waves goes in and creates vibration in the crystals of the stone and kind of pulverizes it, and then people just pass it out through the urine. So it's the same philosophy that applies to patients with erectile dysfunction. And so this particular procedure for ED has been around in Europe for at least 15 to 20 years. It came to this country about maybe 10, 12 years ago. And now, since then, there are thousands of patients who have gone through this procedure. And it does work a lot of times. But the key here is to be able to pick and choose the right patient who will get the benefit of this procedure. So the way I evaluate a patient who I think can get the benefit of this, I'm going to use the word ESWT, is by screening them. So if you step back and look at what it takes to have a functioning sexual life, you need to have several things lined up. Number one, your testosterone levels should be good. Your overall health needs to be good. You need to have your cholesterol levels under control. You need to do everything possible to reduce the development of plaque, the atherosclerosis, whether it's in your heart, whether it's in blood vessels in the brain, or whether it's in blood vessels in the penis. Okay, that's the common thread. It's blockage of the blood vessels that causes erectile dysfunction the older we get. So one of the patients could
Is that
be.
why sildenafil citrate is such a number one prescribing drug?
Yeah, exactly.
Viagra?
So yeah, so Viagra will work. So the question that comes in is, and this is very common, Viagra and Cialis will work for a certain period of time, and then a day comes in when the little blue pill stops working. Now, why is that? The reason for that is your plumbing, which is your blood vessels, are all blocked up. Okay, so you can have the Viagra and Cialis pump in as much blood as possible through the blood vessels, but if it's blocked up, nothing's going to work. Right? So it will not work until the plumbing is cleared up, until you have open blood vessels in the pelvic area leading into the penis. If you do not have that plumbing working right, you can do, tons of Viagra and Cialis. It's not going to work. And the same thing goes for testosterone. Testosterone, I look at it as the engine oil. Okay, so if you don't have the engine oil, your Ferrari ain't going to get out of the garage. It's going to stay parked in the garage. And with no gasoline, you're done, ain't going anywhere. And unfortunately, the older we get, the chances of us going through this is pretty high. I mean, it's so age is one of the biggest reasons for ED. Now, there are other risk factors for ED. Number one, like I always already pointed out, any manipulation of the prostate, whether it's prostate cancer, radiation, surgery, can have an impact on the nerves leading up to the penis area. That is necessary. So, patients with diabetes are at high risk for damage to the blood vessels, whether it's the heart, lungs, and heart, or brain, or in the penile area. Hypertension, coronary artery disease, obesity. These are all the risk factors that happens to play a role in the creation of erectile dysfunction. So when we evaluate a patient for this procedure, the first question we ask is, when was the last time Viagra and Cialis were working? That'll give us a nice time horizon as to how long this blockage has been going on. So if they say, Viagra worked till a year ago, and I'm doubling up on the dose and it's not working, then we know there's something going on. So what's the first step? Make sure that the other parameters are okay. Is the diabetes under control? Is the blood pressure under control? Is the cholesterol levels under control? Are the testosterone levels adequate? Because you can open up the blood vessels with this procedure, but then by the time they walk up to the door, if their underlying factors are not corrected, they will go ahead and block up the blood vessels that's within a couple of days. So what have you done? You've just given them a temporary opening up of their blood vessels, but then if they have not corrected their underlying issues, that blood vessel is not going to remain open. It's just going to close up again. So one of the other factors is smoking. Cigarette smoking is one of the major causes for erectile dysfunction, and that's because of blood flow issues. So anytime that we have patients go through this procedure, we got to make sure that their underlying issues are taken care of. They stop smoking. If somebody's continuing to smoke with this procedure, it's not worth doing any kind of procedure for ED. It's just not worth it, because your results are going to be really pathetic. And spending thousands of dollars on this procedure, when you're sure that it's not going to work in somebody who's smoking, I think it's something that people really need to take this seriously. So that's how we evaluate this procedure. So patients who come in are those who had the benefit of Viagra and Cialis, and then it stops working. So that's a great indication. Making sure that the other things are taken care of. So the question is, how many sessions do we need? What are the side effects? How do we do this, and so on and so forth. So let's start from the beginning. So this is a painless procedure. Okay, so we have if you look at any website, if you look at my website, lifewellmd.com, there's a bunch of blogs that I've written up about how this stuff works. So basically, it produces sound waves that are passed over the penile area, focusing on the blood vessels in that area and in the surrounding areas around the pelvic areas. So by using these shock waves, what we are trying to do is shake up the plaque in the blood vessels and allowing the blood to flow freely. So the analogy I give is, if people are familiar with South Florida, we have I-95, right? The main highway that goes north and south. So when it was first created, the flow of traffic was very smooth. Plenty of lanes, cars going, no issues at all. But 60 years later, everything that that's going to happen is going to happen. Potholes develop. The asphalt starts breaking apart. Now the traffic goes slower. It's the same thing that happens in the penis. Okay, so because of all the plaque buildup, obstruction occurs, the blood flow doesn't go as well as we need it to. So when we use this procedure of sound waves, you're basically kind of shaking things up, allowing the body to reformat all the blood vessels. It's like sending in a construction crew onto 95 to kind of clean up all the mess that there is, clear up all the potholes and fill in all the asphalt, kind of even out all the lanes so that the traffic can go back to running smoothly. So that's exactly what happens with this. So the starting point is to figure out underlying causes, and number two, figuring out the degree of severity of the obstruction based on what we have a scoring system. So IEH scores are the ones that we use to determine the severity of their erectile dysfunction, and based on that we recommend anywhere from 6 sessions of this procedure to 12 sessions. So we generally do this twice a week, never back to back. So if somebody has mild ED, then we get decent results with about 6 sessions. If somebody has really severe ED, we go beyond that, maybe about 12 sessions spread over a couple of months, at least twice a week. Like I said, never back to back. No prep work is necessary. Patients come in the way they are, spend about 40 minutes with us. I use a local anesthetic, not an injection, but a cream that we apply to the genital area, and we use this procedure. Again, the patients feel a little bit of discomfort, but nothing major. So we there's a certain amount of these shots, we call them shots, that we give to each area, um, and then that's it. They're numb after that for about a couple of hours, but once the numbness wears away, now they're back to doing whatever they need to. So a couple of things that we help them along with this is to have these patients use a penile pump. And the reason for that is to encourage blood flow into the penis. It's not to have a usable erection. That's not the intention. The intention is to encourage blood flow through newly opened blood vessels. And we also put them on Viagra and Cialis. Again, what's the intention? To encourage blood flow. Not that we are expecting results overnight, which sometimes does happen. They start telling me that, hey, it's beginning to start working. The maximum results will take at least a few months for them to experience the full effect of the 6 or 12 procedures that we have done. So that's basically it. Any questions? I know I've been kind of quick on this. Any specific questions that I can answer? I hate to take individual issues. I mean, that's kind of private. If you guys have general questions that can apply to anybody who's listening to this, that would be really good.
So, so let's do a walkthrough really quick. So, when a patient comes to you for them for men's health, especially men's sexual health, you do a whole blood panel. Is there?
Yes. So focusing on testosterone levels, thyroid hormone levels, those are the two things that we look for. Because if somebody has subclinical hypothyroidism, we need to correct that. So try to correct whatever we can correct. And then I leave it up to the primary care docs to make sure that their blood sugar levels are okay, their cholesterol levels are okay. They've had whatever screening that they have done. Again, make sure that their basic medical needs have been taken care of, and it's being addressed, that it's not ignored. Okay, and then we work on all this. So let's say if the testosterone levels are low, I mean, I have a way of trying to optimize that level. And that's the whole, I think we already talked about this, a couple of weeks ago, how to optimize testosterone levels. So we need all that on board. So in some patients who come in totally unprepared, I encourage them to go ahead and get all these things taken care of. And then, even if it takes a week or two, to make sure that we are starting off this procedure on the right foot, because we want to maximize the results of whatever we do. No point in spending a few $1,000s when no prep work has been done. I had patients who came in who had gone to other physicians and other practices for this particular procedure with testosterone levels that is so low, you can't expect a Ferrari to run. You can't even pull it out of the damn garage. So forget about having this procedure done if your testosterone levels are suboptimal. And these are the things that are missed out for the most part in a lot of clinics, which means that patients are not getting the best result that they should get. So we need to make sure that everything that is broken is taken care of. And then you do this procedure. Now you have real staying power. Now you have real results.
You know what I come to discover also when this is a while ago, but I always think about this. So when I first got into age management medicine, I worked for a compounding pharmacy, and again that was like in 2004. That's when I worked for them, and I remember just like so many younger guys. Like I helped with the doctors and stuff, but there were a lot of young patients who were getting on testosterone therapy, but also they were like. There also a lot of them are like getting sildenafil citrate, which is what we sold, because it's the generic, and that's what they compounded. So I always think of like if you start out young, getting on sildenafil citrate, which is Viagra or even Cialis, because you think that will help you or create more stamina, but doesn't that affect you in the long term? I mean, if you have a whole generation of people using sildenafil citrate, Viagra, and their body, and they're not even in andropause. I mean, they're like just their hormones not even like they're just full of testosterone. Doesn't that cause some type of issues to the body if you're using it too young?
Absolutely. So in young patients, okay, the people who get into the most trouble with erectile dysfunction are those related to medicines, Tanya. So there are a whole bunch of mental health medicines that are used for mental health that have erectile dysfunction as a side effect, creating low testosterone levels as a side effect. Okay, so drug addiction issues have an issue with a drop in their testosterone levels. So there's a whole slew of issues that happens in younger men that's different when we think about ED in older folks. In younger folks, it's not that we got to correct their underlying addiction issues, their smoking issues, their testosterone levels, their medication that they're on that they may be contributing to erectile dysfunction. So one of the things that I've observed, which is kind of crazy funny, is patients are placed on testosterone, okay, replacement, and then they're given a whole bunch of testosterone blockers, okay, like Femara or dutasteride, finasteride. Now, on one side, you're giving them testosterone, on the other side, you're blocking them. It doesn't freaking make sense.
Yeah,
You
the body
see,
gets confused. It goes up and
it's
down,
not only
up and down.
confused. You're playing both sides. You can't,
Let me say hi to
take a
hey
side.
Amanda. Amanda, are you saying did you want to share?
Yo, I just love the topic right now, and thank you so much for Dr. Kumar for being here today. And I'm enjoying the talk with my spouse as well, and learning a bit and interacting with what the conversation is. And sometimes I guess people don't take in consideration things like BMI and other things like that when they use these type of products. So they, then it becomes more of an individual case on how to treat and why it's not successful versus yes. I don't know a lot about the topic, but yeah.
Yeah, absolutely. So think about this like any other medical procedure, right? So you got to pick the right patient. You got to take care of the underlying issues. So I'll give you one blatant example. People, folks, men who work night shifts, okay, have a major issue with testosterone levels that has to be fixed because testosterone surges during your sleep. The REM cycle, early morning hours, is when you get the boost of testosterone coming out. And so, if you're wide awake during when you're working at nights, your body's kind of messed up. In fact, its whole rhythm is set off in the wrong way. So you have not only ED as a result of testosterone issues, but then what do you do about your work? What do you do? So these are the questions that we need to ask, and just don't blindly throw this procedure, sound wave procedure, at them, saying, "Oh, well, let me take you $1,000 for it, and then to hell with the results." I mean, this is what can go wrong with our medical field. When people just dive in, when people call me and saying, "Oh, I want Gainswave or whatever," Gainswave is a particular brand of this procedure. I'm part of that group. We follow protocols and make sure that we do the right thing. But the point is, if people just call me saying, "I want Gainswave procedure," the first thing I do is, why? Let me figure out what your problem is so we can fix that damn thing before we start jumping in and taking money instead of, and if they call some other office, they say, "Oh, I want Gainswave procedure." Okay, come on in, give me a few $1,000s, I'll do the Gainswave procedure, see you, and to help with the results. Okay, that should not the way it should be. Make sure that we do the right thing for the right reasons. Making sure that the results stick, that the patients are happy with the results, their spouses are happy, they're back to having a good relationship, and they can go ahead and now we can talk about age reversal and age management, all the other good stuff. But without correcting this underlying issue, which by the way is a huge epidemic right now with everything that's going on around us. No, stress levels are destroying our testosterone levels. The constant patter of bad news just coming out through every information channel, whether it's the internet, radio, or TV, whatever. We're just being bombarded with crap 24/7. And we just have to learn to overcome that because it does have a huge impact. May not be consciously, but subconsciously, it is driving our biology down across the board. So that's the word of caution that I have for you folks. So the takeaway message for you: don't look for the procedure. Look for somebody who can help your overall sexual wellness. Because
So Brent is DMing. He's at work right now, but he wanted to know how
okay.
can he check for his sexual health. I mean, isn't that like just having the male panel done?
No, the thing is, so go through the scoring. If you guys talk to me, I'll walk you through that scoring system, and that will give you, again, it's very subjective. Okay, it'll give you some numbers to go by, and by looking at that and taking a little bit of a history, figuring out where things are, then I can figure out what the problem is, and so that way you just don't blindly run in and get a hormone check done. I know that's not going to help us any. So just take it like any other medical advice. If you have an issue, just talk to your doctor, urologist, or somebody who knows something about sexual medicine. By the way, sexual medicine is not a topic in any medical school or in any training program. It just doesn't exist. Testosterone is learned by the endocrinologist. Okay. Erectile dysfunction is being addressed by the urologist. And what they're trying to do is prescribe Viagra and Cialis or a penile implant. So what I'm suggesting with this procedure is something in between, where the blue pill is not working and you don't want to take the extreme measure of having a penile implant. So a time may come that you may end up needing a penile implant, but at least till then, we can kick the ball forward with this procedure and still have you functioning the way you want it to function. So there's a methodology to this whole thing. And again, people need to figure out, make sure that your overall health is in place. In other words, you need to have your foundation rock solid, right? Before you start spending thousands of dollars in fixing one particular problem, because that problem can be fixed temporarily. But if that foundation doesn't hold it, the whole thing will just collapse on itself. It's not going to work. So it's not a Band-Aid. Make sure. And that's where I've come in. I mean, it's a sweet spot that I've found. So my results are freaking amazing. I have patients that see the problem with ED. I can't get these guys to give a testimonial unless it's anonymous. But then if it's anonymous, then it could be anybody, right? Anybody can cook things up. So it's tough.
Yeah, I don't think most men would be like thrilled
open
on
about it.
Camera to say,
Yeah.
"Hey, I have this problem," and because I went to see Dr. Kumar, I'm up there again. I don't think people would do that.
Yeah, so that's the reason in any place except on my website, on my office, anywhere that I mention anything about ED. For all they know, I'm a cancer doc. I take care of chronic pain. I do acupuncture. I do all these other fun things. And by the way, help patients have better sexual function. Again, my whole core was to help my prostate cancer survivors. Then I found out it helps in so many other situations that it's been really rewarding. The kind of changes that I've created in patients' lives.
As a Puerto Rican woman, I didn't know that people struggle with that in the U.S. as often as they do, because it's very different from culture, right? Because the men in my culture, they're pretty active in that sort of way, and so are women, and so I don't see the kind of the auras and the vibes continuously being played in different aspects of life here in the US. When I moved to the US, seeing things, the connection seems so cold. People don't really feed into that kind of like locking that that experience, right? They're so multi-focused on different things. They're overly stressed about things in the future, and it really affects the moment. And when you're in that moment, you can't have things blurring you out. You really have to be able to lock in, zone in, and deploy your action, right? So
yeah. You got it right. I mean, so the thing is, if it's a young person, the first thing that's on his mind is how to make a living. Sexual health goes into the background. His overall health goes into the background. And then as they get older, they hit 40, 50, they've achieved something in their lives. They're financially, they're stable. Now they wake up and say, holy cow, what happened to my wife? She's throwing out a divorce at me. Why? Because you didn't pay attention to her. All of a sudden, then you wake up and say, oh my God, my Ferrari is sitting in the garage. It's not getting out. There's no fuel in it. That's when you guys come to talk to me. And I'll get that Ferrari up and running in a heartbeat.
Oh,
Just
vroom
kidding, though.
vroom, vroom vroom. I like that. I like that. You're so cool, and I wish that that you were more local so that I can. No, I'm just kidding.
Dr.
Make an
Kumar used to have
appointment.
this saying. Dr. Kumar had a saying, not make America great again, but make America hard again. Is that what you said? What was it again,
Happy
Dr.
again.
Kumar?
Make America happy again.
Oh, I'm like, I'm thinking hard again.
I like Tanya's
Sorry.
version better.
Hey, I don't know if you're going to get this censored, but also make America horny again.
Make a horny again. That's what we need.
Good one. Yeah, we definitely need more of that. And Brent
Hey,
is over
listen.
there as a listener, like laughing. He's loving this.
Yeah, listen. You know how much the world would be at peace if everybody's sexual function was just perfect? You think we'll have a war in Ukraine
That's
or
what
Russia?
I'm always saying, Doctor. I'm always saying that. Yeah. So how do you want me to address to you, by the way? Because I'm not in a clinic, and it's however you prefer, right?
It doesn't matter. Call me what? You know what they call me in my Palm Beach Gardens office? Dick Duck.
That's a good one. Quack quack.
Hey Tanya, are we going to be censored by freaking Twitter and YouTube because we're all?
Oh no. I'm actually I played music. I did the testing. I'm gonna clean that up. And no, you didn't do anything wrong. This is perfect. This is great information.
Cool. No,
that
but
most
hey,
people are
listen.
afraid to talk about.
This is a physician's medical topic that we are addressing serious medical issues. Seriously funny. But seriously.
No, we have to be seriously serious about this. Hi, Kiki. My friend Kiki is here, but it's about 1:59. Let's go ahead and close out the space. And again, thank you, Amanda, for being here, and Brent and Kiki's popped in. But Dr. Kumar, before we let you go, can you tell our listeners how to get a hold of you?
Yeah, listen. So my website is lifewellmd.com. lifewellmd.com. If you guys have some personal stuff that you want to talk to me about, feel free to text message me at 772-332-9975. All right, this was fun. I'm glad that we could share some
Doctor,
of the stuff that
before we leave from really quick, do you mind following? Oh, you did follow me back. So cool.
Yeah,
I
did
have a quick question of about that I didn't quite catch time to get the answer here. So I don't want to interrupt the closing of the session. So thank you so much for the opportunity, and I hope that I can get that answer out of you and
absolutely. No worries, Amanda. Send me a text. We'll chat. All right.
Thank you, Amanda. Thank you, Brent.
Thanks,
Thank you, Dr.
Tanya.
Kumar.
You're the best.
Thank you, everybody. Have a great day.
Yeah.
I'll be back
Till
next week. Bye.